Hi, my name is Becky Sanders. I am the Program Director for the Upper Midwest Telehealth Resource Center. Thank you for joining us today. There's three main questions that we're going to answer today as part of this virtual office hours. Let me get back to my list here. So these three questions that we're going to review today are, would you like to see patients in multiple states? Can you see a patient via telehealth for the very first time? And how do you document patient consent? So with the COVID pandemic, the public health emergency, we've seen sweeping changes across the nation this year as far as telehealth and what can and cannot be done and reimbursed for via telehealth. So thank you for joining us today. We're going to put you all in listen-only mode, but then I do want to keep this interactive. If you do have a question, you can go ahead and put that in the chat. You can also unmute yourself and ask a question. And we do have a smaller group today, so we do want to keep this relevant and interactive. So let's start off with the first question. Would you like to see patients in multiple states? And there are several compacts that are available. I'm going to go ahead and share my screen so we can look at some of these together. And then I'll put, once I've showed you the, what screen? Okay. Once I've showed you the sites, then we will, I'll put those links to those URLs in the chat as well. So I'm going to start with the Physician Licensure Compact. This is the newest of the different clinical compacts. And as you can see here, Indiana does not participate in this compact. However, two of our other states, Illinois and Michigan, do participate in this compact. And Ohio introduced it a couple of years ago, and then they've reintroduced it just in September of this year. So we may see Ohio participating in the Ohio Physicians Licensure Compact. And the Licensure Compact, what it really does is it's a paperwork reduction act, and it helps to ease the burden of paperwork on a physician in this particular case, so that they can fill out the paperwork once and be licensed in multiple states and go through that procedural process. And then it's easier to keep track of where they're at as far as renewing their license in different states. The Nurse Licensure Compact has been around for a very long time. And you can see here now Indiana participates in this one. Michigan has pending legislation and Ohio has pending legislation, but Illinois does not participate in the Nursing Licensure Compact. There is also a Psychology Licensure Compact. So we see here we do have the Psychiatry Licensure Compact is available in Illinois. So Illinois is participating. And Indiana's not. Ohio and Michigan have pending acts to participate in this particular compact. Now I know there's and I need to go and copy those. So let me stop my share again here. There are other compacts. There's an EMS line compact. There might be physical therapy or speech language pathology. But I wanted to highlight these three, the physician, the nurse, and the Psychology Licensure Compact, because those are the ones that we get the majority of the time. So here, I'm going to put these in the chat. And while I'm doing that, do we have any questions? Welcome to those of you who joined us after we got started. Again, my name is Becky Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. We do have our Zoom set up in a meeting format today, so we do want to make this an interactive discussion. Luke Wartley and I just have some small things that we want to share with you, and then we want to open it up and have a interactive discussion with you today. We are recording this session, so we will put the recording on our YouTube page and then on a link on our archived webinars page as well. All right, so there's the physician compact, and let me paste the nursing licensure compact in here. I've got a question about a licensed therapist, and that one I am going to have to research that one. I am not aware of that off the top of my head. Is anyone else? Okay. How many of those on the call are clinicians where you are licensed in multiple states? Is anybody participating in any of the compacts? Anyone? That's a good question. I had a question about the nursing licensure compact, if it's only RNs or APNs as well. And I also do not know that one off the top of my head. So I will put that on our list to review. And a question about dietitian compacts. That I don't know. I haven't heard about that.
Becky, the nurse licensure compact applies to let's see here. I have it right here. It applies to RNs and LPNs. An APRN must hold an individual state license with each state.
Okay, thank you very much. And here is the psychology one. All right. And then the second question we wanted to make sure to answer today is, can you see a patient for the first time via telehealth? And during COVID, the answer is yes. And this can depend on which insurance is being billed. Prior to COVID, you might have had to see a patient in person before you could prescribe a controlled substance. That was part of the DEA laws if you were a prescriber. In our 4 states in like the 2017, 2018 timeframe, mostly because of the opioid crisis that we've experienced, the state legislatures changed the laws in the Indiana, Illinois, Michigan, Ohio states where you could see the person, the individual, via telehealth on the very first time. There's certain clinical things that have to be done to establish that patient-provider relationship, but then you could also prescribe on that first visit. So if you've got any questions about prescribing specifically, I'll go ahead and, Luke, can you find the link to the reimbursement site where we've got the 4 states and look at what we've done is we've created a state reimbursement summary for each of our 4 states. And in that, you can find links to Medicare reimbursement guidelines and Medicaid reimbursement guidelines, and also the in many cases, the list of codes each Medicaid program will reimburse for, and the laws around, sometimes states define telehealth or telemedicine in different ways, and how it's actually codified in state law. Thank you, Luke, for doing that. Any questions on establishing patient-provider relationships.
Becky, I don't know if you're going to address this later on, or if this is the appropriate section to ask this question in, but are the states requiring permanent licensure in each of these 4 states right now? What's the temporary licensure?
They're not, and it's very much in flux. So that is exactly where I want to go next. So great question, great lead in. Let me go ahead and share my screen again here.
Becky, could I ask a question about the telehealth piece quickly?
Yeah.
Hi, I'm wondering if, I think in Indiana, there used to be a form that you'd have to submit to do telehealth certification, or an established, you'd have to submit that form to the board before you established a patient relationship. Is that
that is still, yeah, that is still in play.
Okay, and you'll probably get to whether that's required for out-of-state folks here as well.
Correct. I will.
Okay, thank you.
Yeah, that's a good reminder. So we'll talk about this at a kind of high level, and then we'll go in. I'll find that Indiana form, and we'll review the website to make sure it hasn't changed since the last time I looked at it. So from a national perspective, and Luke is our frontline person who gets all of the emails that come to us and folks that call our 800 number. So he sees this a lot. As far as what's going on with seeing patients in a state you're not licensed in. Early on in COVID, it was pretty much fair game. It was take care of your patients, do what you need to do. We're 8 months into this now, and the numbers are on the rise all over the country. Each state is handling it a little bit differently. But on our national policy website for all of the telehealth resource centers, I'm going to put this link in the chat. And then there's I'm going to show you the different federal or Federation of State Medical Board links. So this is one on license requirements and renewals, and then one for telehealth. So there's 2 different links here. So this first one, this is really where you need to go. If I use Indiana because I'm in Indiana. So I'm a provider in Indiana, but I've got patients that I see that live in Kentucky, and right now they're staying at home and I'm seeing them from home in Kentucky, but I'm not licensed in Kentucky. So what I need to do is I need to come to this list and I need to look up Indiana and see what Indiana says. And then I need to go down to Kentucky and see what Kentucky says. They keep the federal or state medical board, they keep this list up to date, and it's changing on a regular basis as each state extends their own state executive order for the public health emergency. It can change and affect this. So this is really your best place to go. There is not a black and white answer for this right now. So let me pause just a second and put this in the chat. So this is the FSMB link. Oops, why is that not working? Luke, have you run across anything else specific to cross-state licensure recently?
Nothing that's any more specific than what the Center for Connected Health Policy is putting out.
And I was looking, here's the link to that Indiana site. So let's see. Liability, I think this is what we want.
Becky, I
here it
actually
is.
the other day, and Indiana has this temporary healthcare provider registry, but it's not clear to me if that applies to telehealth providers and if you then also need to do the telehealth certification.
Let's take a look. I would call them to be sure, my understanding so far, without reading everything on this page and taking time out of this call to read it, is that once you have filled out this form that you're okay, as long as you're licensed and in good standing in the other state.
Yeah, because I actually filled it out the other day and it only took about 24 hours for me to get a reply back from them saying I was approved. But it says that I'm approved as a healthcare provider, an out-of-state healthcare provider, but it doesn't specify anything about telehealth. So my question is, do I have to fill out the telehealth form, and do I put that temporary registration number in where
Gotcha.
it asks for Indiana license?
Gotcha. Okay, so you filled out this one. Let's see what this one says. I don't know, Luke, have you looked at this one?
Not in a couple weeks. It hasn't changed though.
Okay. Yeah, I would call them just to make sure. This is only one I see that references telemedicine here, controlled prescribing, and then there was one for behavioral health, mental health providers. So yeah, just to be safe, I think I would call them and double check. But based on what I'm seeing here, just at a quick glance, I would think that you're okay. Sorry, I can't be more specific. All right, any other questions? All right, at this point, I am going to stop sharing my screen and I'm going to hand things over to Luke. And Luke, I realize I didn't introduce you at the beginning if you want to do your own introduction, but Luke's going to talk to us about consent.
Thanks, Becky. I'm Luke Wartley. I'm the program coordinator for the Upper Midwest Telehealth Resource Center. And as she mentioned earlier, I'm the person who kind of monitors our 1-800 number, as well as our referrals from the National Telehealth Resource Center site and our technical assistance form on our own website. So in the interest of time, I'm gonna go ahead and get going and talk about consent and documentation for each of the 4 states. There we go. And starting with Illinois, I guess it should be noted that all 4 states have similar language, and they're all, I have the links for where you can find that in the administrative code in the links here and the slides. So in order to get a virtual check-in or receive telehealth services during the COVID-19 pandemic and the public health emergency, verbal consent has been authorized as a legitimate form of consent. And at the end, I'll kind of get into what a functional telehealth or telemedicine encounter and getting consent should look like. But Illinois basically just says that the patient must verbally consent and that it must be informed consent. And the documentation standards are found in section 140.28 of the administrative code. And I've got a link to the records required right here. Basically name and license number, provider on the distant site, at the originating site, that sort of thing, which is also pretty consistent language that we've seen across all 4 states. So I'll move on to Indiana. Again, Indiana requires informed consent, and I've got a link to where you can find that in the administrative code. Indiana's documentation standards, I think, are best described per Indiana Medicaid, and the link to that language is also right here on the slide. Again, we have documentation must be maintained at the distant and originating site to substantiate the service. And I'll go ahead and move on again in the interest of time, just so we can have questions and keep the conversation going. Michigan's definition is really succinct. a health professional shall not provide telehealth service without directly or indirectly obtaining consent for treatment. And that is per Chapter 333, Act 359 of the Indiana Administrative Code and compiled laws. I've got a link to that as well. I will say that out of the 4 states, the Michigan Medicaid Provider Manual on pages 51 to 56, because it's a multiple thousand-page document, so I went ahead and just put those page numbers in there, have the clearest documentation standards out of the 4 states in terms of like what you need to keep where. So if you're ever in doubt, I would definitely check out this link and go to pages 51 to 56. And that's on the document themselves. You may, when you're opening up a digital version of it, it might, the page numbers might not line up directly. Ohio has a little bit of an extra section on there that says that providers must document their use of telemedicine and meet minimum standards of care. And I've got the standards of care listed right here, as well as a link to them. So that was just a little bit of a wrinkle that Ohio has in it that the other states don't have. And then here's their actual definition: written consent to a surgical or medical procedure. And of course, obviously during the public health emergency, verbal consent is okay as long as it's documented appropriately. And Ohio's documentation standards can be found here in this link within the slide. So I want to talk briefly about what this functionally means. I've mentioned several times that during the public health emergency, verbal consent is okay. And I've got the link to where you can find that information. And it must be documented pursuant to the codes in your state. But what we've been telling providers to do is if written consent is not an option, that if you're having a live and interactive session like this, a synchronous session where you're both on video, is to share your screen and actually kind of walk them through the informed consent for telehealth consultation form. A lot of them mirror in-person consent to treat forms and release of medical information. So they only take, a couple minutes to go through, and they can even be as short as 1 page. We have sample consent forms on our website. I've got a link to a 1-pager right here embedded in the slide. And if you're at all worried about a HIPAA sanction or anything like that, I've got a link to their frequently asked questions. As most of us know at this particular point in time, HIPAA sanctions are in a little bit of flux at the moment. You should still absolutely be using encrypted software of any kind. You should be using a HIPAA secure. I'm hesitant to use the word HIPAA compliant, as compliant is a policy thing that your own organization has to take into account. The actual software itself can be HIPAA secure. So I strongly advise you to use HIPAA secure software, share these informed consent, and document appropriately that you've attained verbal consent at the very least, and you should be covered during this time of public health emergency. Additional resources here on the end slide, as well as mine and Becky's contact information. I've got COVID-19 resources specific to each individual state, previous archived webinars, technology toolkits if you're not quite sure where to get going on that particular stuff. And if you're not already subscribed to our newsletter, I've got a monthly newsletter subscription link embedded right here as well. So I'm going to go ahead and stop sharing and see if we have any additional questions, or if we want to potentially return to what, in my opinion, is probably the more exciting topic, which is telehealth across state lines.
Thanks, Luke. Questions? All right. As you guys think about your chance for final questions, I am going to put in the chat a 3, 4, 5 question survey. This helps because we are federally funded and we are required to provide feedback to our funder. The survey helps us to know if we're hitting the mark on the education that we offer, and there's places for open comment. You can comment and tell us that if you'd like to hear about other topics in the future. Also, we're always looking for best practices. If your program you want to share what your program has done to overcome barriers or best practices, let the world know what it is that you're working on. We welcome your information on that. We can follow up and talk about having you do a webinar for us at a future date.
Hey, Becky, how long do you think it would take to be able to post these slides?
That is a question for Carolyn.
I just saw a question in the chat.
Oh, okay.
I can have the slides posted by Monday afternoon.
Okay.
Great.
So we'll get those posted and those links will be out there. If there's something specific, a link or a resource we talked about today that you need before Monday, then shoot an email to either Luke or I, and we'll get that to you. All right, last chance for questions.
There's a question in the chat there, Becky.
Oh, sorry. Let's see. Apologize. How the compacts work. If our state participates, we can have providers from other states provide care the other way. Yes. So let me go back just to the physician licensure compact, and we'll just do a little scenario here. So let's say I am in Michigan and I have patients in Illinois. It's kind of a weird one, but we actually do have that happen a lot. So Michigan and Illinois both participate in the compact. So when I, as a provider in Michigan, I'm going to go to this compact website and I'm going to sign up for the compact, and I'm going to check off the box on the paperwork that says, you know, I provide services in Michigan. That's where my main license is, but I also want to provide services in Illinois and Wisconsin. Then I have completed all that paperwork. I'm hearing about 6 weeks for that to come back. I haven't heard recently, but that was the last I heard. But then now I'm licensed to provide services in all 3 states. You still have to fill out, you pay the fees for each state licensure, but you're doing all that paperwork at once. Does that help, Kelsey?
Yes, that does. Thank you.
All
And we
right.
know those Chicago residents like to come up to our little beach towns. So
I guess it's worth noting that you can't apply for a multi-state compact license if your primary residence isn't in a compact state.
Mm-hmm.
So like you can't, like here in Indiana, like even if we would want to participate in the compact as an individual provider, like we would have to do other channels.
Mm-hmm. Yeah, that's a good little nuance to remember. All right, final questions. All right, well, hearing none, we'll let you go with the rest of your day. Have a happy Friday and a good weekend. Stay safe. Take care.